With all that out of the way, thank you again for attending today's webinar. Now let me introduce Kathy Patterson, Director of Validation of BC Solutions. Kathy has over 25 years experience in the healthcare industry, beginning as a medical technologist. Kathy has worked in hospitals and donor centers as a technologist and manager. Prior to joining BC Solutions, she was the blood bank laboratory supervisor at Scott & White Blood Center in Temple, Texas. Kathy, please proceed.
Okay, good morning all. Just as hydrogen and oxygen make up the building blocks of a water molecule, there are certain elements that can comprise a blood establishment computer validation that will ensure that your validation is compliant and complete with and be judged compliant by the regulatory agencies such as the FDA and AABB. So today we're going to discuss each one of these elements in turn. Next slide, please. The elements that we're going to talk about and the process that we're going to talk about today can be applied to any validation that you're doing in your system, whether it's on software, hardware, interfaces, or electronic data transfers, or data migrations and conversions. Today, however, we're going to focus the main focus of our talk will be on blood bank related software itself and the validation of it in your system. You may want to apply this to when you're validating new hardware such as new servers or any peripheral pieces that you're adding to your system such as label printers or barcode scanners. You can use it to validate any interfaces that you have, whether it be an instrument interface to your blood bank system or electronic data transfer between two systems such as what you would find between your HIS and your blood bank system, or a reference lab system to your system, or an instrument interface with sending results to your blood bank system. And you can also use these elements to validate your data migrations and conversions when you're moving from one system to another. Next slide, please. So this slide is going to list the elements that we're going to talk about today. That each one of these should be documented as part of your validation process to ensure that it is complete and compliant. You know, and although I'm going to present them in sort of a linear pattern and go down the path for each one, realize that these are all interrelated and that they're just pieces of the puzzle that you're going to fit together that will ultimately become your validation of your blood bank software system. The elements we're going to talk about are going to be validation policy or plan, requirements, risk analysis, validation scripts, proof of performance, documentation of issues, and review and approval of validation. And as I said, all of these will fit together to form your complete validation. Next slide, please. The first element we're going to talk about is your validation policy or plan. And you may also know this as master validation plan. You may call it a complete change control process or your validation process. But whatever it is, it's going to be the plan of action it's going to describe your plan of action for validation, what actions you need to do to obtain and maintain a safe and compliant blood system. Margaret Thatcher once said, plan your work for today and every day, then work your plan. And that's what this validation policy or plan should do. You should be able to plan it out in advance and then follow through on it to create your validation documentation. The validation plan should answer at least each one of the following questions: the who, what, when, where, and how of validation. So let's look at a few of these in a little more detail. What do we need to answer when we're looking at these questions? When you're thinking of when, you need to decide beforehand, when are you going to perform a validation? The regulatory documents state that you need to perform a validation with install of a new system at routine intervals or routine changes, and then when there's a major change made in the system. But you know, other times, and what you consider those major changes and other times that you might want to do validation need to be determined by each facility itself. So you have the ability to decide what does those terms mean to you. You would decide what validation you're going to do when there is a major change. You need to make a definition of what a major change is in your facility. Is it going to be an upgrade to the system? Is it going to involve just a change in the configuration of the system? What do you consider to be that? What are the triggers for when you perform a validation? You also need to look at what's going to happen when you convert data from one system to another, or when you add new hardware or software. Are you going to redo your entire validation, or is it just going to be a few pieces and parts here and there? So those are items that you can decide for yourself within your facility that's going to meet your needs. So the determinations for when and what validation you're going to will be done by each facility, and these should be addressed before a need for validation arises, and it should be documented in this validation policy or plan. You also need to look at the who questions. Who will be responsible for the validation? Who will develop the actual validation scripts? Who will implement them? Who will review the outcome of the validation? Who will have the authority to make the final decision on whether or not you go live with this new or changed system? Who can make changes in the system after the initial validation is performed, and what will happen after that? The validation plan needs to specify the specific person or the position who will be responsible for each of the tasks in the validation. You also need to determine how you're going to do the validation. Are you going to do it in-house, or will it be contracted out? If you decide to contract out your validation to a third party, you need to specify either in the validation policy and plan or in another document the qualifications that need to be met, that vendor needs to meet for you to select them. One other question that I want to address is you need to describe where in the validation documentation will be stored in your validation policy or plan. There needs to be more than one person in your facility that knows where you're keeping that final documentation. And so you should state where it is. If that person who has reviewed it and stored it leaves your organization or is no longer associated with your organization, someone else needs to be able to get to those documents in case you have an inspection. So if you have a need for validation coming up, or even before there is any need, you could sit down and complete this validation policy, answering those questions, making those decisions ahead of time, so that then you'll be better equipped to handle any validation that comes up. And realize with this, each organization has the ability to determine and define when your validation will be done, what will be done, how it will be performed, who will perform it, and where you store the documentation. And once you have this plan outlined, then you would follow the plan whenever a need for a validation arises. And please note that the items that we're going to talk about today and the plan that you lay out for your validation would need to be observable in the facility's final validation documentation, whether you perform the validation or whether you contract it out. Next slide, please. So let's give a short definition. Let's define what validation is before we move on. Now, the 17th edition of AABB Technical Manual gave the following as the definition for validation: that demonstration through objective evidence that the requirements for a particular application or intended use have been met. Validation provides assurance that new or changed processes and procedures are capable of consistently meeting specified requirements before implementation. And this is an elaboration of the definition of software validation in the FDA guidance document, which states that software validation means confirmation by examination and provision of objective evidence that the particular requirements for the software's intended use have been consistently fulfilled. So what they're saying is that validation is more than just testing your system, verifying that the functionality works or that your tables are set up correctly. It is verifying against a set of requirements that your system performs appropriately. Next slide, please. So what are requirements? Requirements are just simply statements that specify what a user expects or wants a computer system to do. They're statements that say how you want a system to respond in certain situations. So then validation just becomes verifying the system performance against your expectations of that system. For example, in a blood donor center, you would want your system, your computer system, to flag a unit or prevent you from distributing to a hospital a unit from a donor who's tested positive for HIV. That's the worst case scenario you can think of. So your requirement would state something like the system shall provide a method to prevent a unit from a donor with a positive HIV test from being distributed, or it shall, not allow you to even get to the distribution. You would write it however you would want the system to respond. Your test case then would be to enter a donor, result that donation with a positive HIV test, and then see if you can get to distributing that unit or issuing that unit to a facility. You may not be able to even label it. Therefore, it is blocked from you sending it out because you can't send out anything that's not labeled. So that's how you would work your requirements that you develop. You can develop requirements. There's no standard set of requirements out there for you to use for validation, and no one specifies what you need to validate itself. That's up to you to determine for your own individual facility and system. You might use a previous request for information or request for proposal, the specifications that you listed that you wanted a computer system to do for you. You can use the ABB record-keeping standards to develop your requirements. You can use the critical control points of a system, those places where there are decisions being made by the computer system. You can set up requirements that will verify those. So although there's no hard and fast rule of what the requirement should state, there are some guidelines set up on how to write requirements. They should be developed prior to the start of the validation. You cannot perform a validation on a blood establishment computer system without requirements. They should be written statements, documented, in language that is understandable and clear. They should be testable or measurable, so that they can be verified, so that you have some objective evidence of how the system responded. The requirements should be singular, in which they address one need, function, or expectation. And they should be traceable. You should be able, just as you're able to trace a unit through your system, you want to be able to trace a requirement through your validation. Where was it used? What test case was it used, or test script was it used in? Where did you test it? Where is that proof that it was tested? And what was the evidence that showed how the system responded? You want to be able to test that. The ABB assessment tool even asks that assessors verify that user validation is traceable to user requirements. So you do need to show traceability. Next slide, please. The next element that should be available is part of your computer system validation, and this is going to also interrelate with your requirements and with your validation plan, and ultimately with later parts of the validation that we're going to talk about, will be a risk analysis. Now, a risk analysis is a method of identifying potential issues or hazards that can harm a patient, donor, or business if failure or malfunction occurs. A risk analysis for a blood establishment computer system validation needs to be documented, and it does need to be performed. You do need to, in your validation plan, develop what sort of risk analysis you're going to do. If you're a transfusion service, you might want to look at risk to patients. If you're a donor center, you might want to look at risk to patients and donors, as well as to your business needs. But you're going to have to, you need to look at those places that can cause harm to your system or to your patients or donors. If you try to verify everything in a computer system, it's it will take you a very long time. It would be very time consuming and resource hogging, and it would probably be almost impossible to validate every single thing in a computer system. So in order to focus your validation, you need to do a risk assessment so that you can focus that validation on the highest risk items. You do need to develop, as part of your validation plan, a risk categorization. Now, there are sample ones out there. This is just a sample one here, where a high risk would be that which is considered to be intolerable. It could cause death, severe injury, or harm to a patient or donor. A low risk would be that which is considered negligible, would not cause injury or harm. I think this is the FDA's definition, risk categorization. There's others available in some of the documentation that will be on the reference slide. There's an International Society for Blood Transfusions guidance document for validation that has a sample risk categorization in it. Or you can develop your own and have as many categories as you want, and then determine beforehand in your validation plan what risk levels are you going to want to focus the validation on. And here, if you have this risk categorization, you might want to focus the validation on the high risk and medium risk items, and just for, you may not have time to address all the low risk, but it will enable you to focus and perform a validation without adversely affecting patients and donors and your business needs. Next slide, please. So the sort of things that you would need to perform a risk assessment on, there's different items that you would need to assess for potential hazards. One of the first things would be changes or modifications made to an existing system. If you have an existing system and you're doing an upgrade and you need to determine whether or not you want to do a validation or how much validation you need to do, you would go in and perform a risk assessment on the changes or modifications. And that will help you know whether or not you need to do. If there's no high risk or even medium risk items, if they're all low risk, you may not need to do a complete validation. If there are several high risk or even one high risk item, then yes, you probably do need to perform a risk assessment. A validation after you've done your risk assessment. So that would help you determine whether your decision on what validation you're going to do, how you're going to do it, how much you're going to do. Before you begin an actual validation, you should perform a risk assessment on the system functionality and the requirements that you're going to use in your validation. Again, this will help you focus your validation on those high-risk items, high-risk functionality, high-risk requirements, those critical control points of the system that you need to verify so that you can perform a validation in a timely fashion. You don't have to take months and months and months to perform it. You would be able to focus it and make sure that anything that could adversely affect a patient, a donor, or even your business needs is addressed in the validation. After the validation, you need to perform a risk assessment on any issues or problems that you discovered during the validation. By performing this risk assessment on the problems found and then performing any corrective actions on those issues, you will be able at the end when you're doing your review and approval for final go-live determine, do we have any high-risk items that we can't reduce or mitigate the risk for? If you have some, that might cause you to delay your go-live until those risks can be reduced for those issues found. Next slide, please. Another element of the validation are the validation scripts. They may be called validation testing plans, they may be called test cases, but whatever it's called, the validation scripts will tell you what information to enter and contain the details of the outcomes of the testing. There's no standard script format required. There's no regulations that say, you have to use a Word document, you have to use an Excel spreadsheet. It's whatever's going to work best for you and your facility. However, there are certain items that should be included in each validation script are your validation test cases that you perform. And these items are listed here, the scope covered. And that means it should include, you should have a section where you're describing the functionality that or the requirements that you're verifying in the script, or what you're actually including in the script. What kind of test scenarios are you running in this script? There should be test instructions or entry input, and that's just the information that you're entering into the system. What is the data to be entered? What are the keystrokes to be used? What details are you actually inputting into the system? You need to include expected results. Based on the entry, the data entered, what are you expecting from this system? How are you expecting the system to respond based on the data entered? You need to have either a description of the actual output of the system or provide a place or a link to your proof of performance, meaning that you provide a link to either a screen capture, a video, a report, or something where you have shown how the system is actually responding based on the entry put in, so that you can compare the actual output to the expected result. Your test script should have your acceptance and rejection criteria, and that's just the criteria that you're going to use to determine whether or not the result was acceptable or not, whether it passed or whether it failed. Then you're going to have to, for each test that's done within your script, you're going to have to record the results of that test. Based on the criteria that you've listed, is this result acceptable or not? You need to include the name of the person executing the script as well as the date the script was executed or implemented. And there should be a place on each script for review of the review signature of the person who reviewed the document and the date that they reviewed it. Someone who has been given the authority in the validation plan to review the documentation and review the validation and make an approval of whether it's acceptable or not. Next slide, please. Another element that should be included as part of your validation documentation is the proof of performance, which is the documented evidence of the results and outcomes that were obtained during the validation. And the proof of performance should always be linked to the test cases, to the validation script, and to the requirements. You want to show how did you validate that requirement, what was the actual system response when you did a validation for that requirement. And they should be always included as part of your overall validation documentation. Depending on what you're validating, the proof of performance that's required will vary. You know, it may be electronic screen captures or videos that you made during the execution of the test script. You know, there may be other documentation such as reports or other printed materials that would be adequate proof of performance based on what you're actually doing. For example, if you're validating an ISBT label printer after modification of products, the labels that you actually print out are the labels that you print out in your donor system to label acceptable units for distribution would be your proof of performance, and you would need to keep those, link them to the test scripts or plans, which are then linked to the requirements. Checklists or completed spreadsheets may be adequate proof of performance if whatever you're validating would just require an observable evidence, an observation that you have made. Next slide, please. Excuse me. It's inevitable that during the course of the validation you will discover some issues or problems in the system. There may be things that are not working exactly as you want them to work due to system design. There may be times when the expected response and the actual response of the system in a certain situation did not work. There may be runtime errors. There may be other errors that, you know, the system when the system fails to respond as it should. Maybe the database, you found issues within your configuration or database as you're doing the validation. Any issue or problem that you discover during validation should be documented. You need a description of the problem and what happened. It could be simply, you know, what led up to this issue? How did this issue come about? You also need to perform a risk assessment or risk analysis of this problem, as we stated earlier, that you need to assess whether or not this could harm a patient or a donor if this risk continued. There should be evidence of corrective action documented, whether it's, you know, a configuration or database change, whether it's a system workaround due to just a system design issue. It could be something just like a procedural workaround or a training issue that you need to address with your end users. Those things need to be documented. If it is a high risk to a patient or a donor, you do need to investigate ways to reduce the risk to the patient or donor. Is there some way that you can alleviate this risk? There should be evidence, again, of the person who reviewed the problem and then final approval of that resolution of the problem. Next slide, please. The last individual element that should be part of the validation is the review and approval of all the validation document that's generated during the process. And the appropriate personnel, and those are people that you have already identified in your validation plan or policy, should be the ones performing the review. And the review should be documented. Now, I have on here independence of review. What that means is that you would, if possible, you would have a person reviewing the validation documentation and approving it. It's not the same person who performed the validation. You would want a second set of eyes on it. Now, I know in some cases, in very small facilities, you don't have the personnel that can do that. But if possible, bring someone in from another area that can look over your documentation to make sure that you have addressed everything that you said you were going to address in the validation plan and that all your documentation is correct. That review needs to be documented. And then there needs to be documentation of the final approval for Go Live. And that means that you take all of the documentation that you've gathered, all of the results, problems, all the review that's been done, and have the authorized personnel, the people who were designated in your validation plan to perform this decision, make a decision of whether all of the high risk have been mitigated or reduced or addressed, that there are no outstanding high risk issues, and that they give final approval for going forward with going live with your new or revised system. Now realize that I've stated all this. Whether or not you perform this in-house, all this documentation should be done. If you are contracting a third-party vendor, all these elements should be met in their documentation. But for the review and approval, even if you contract with a third-party vendor, your facility is responsible for reviewing the documentation that's provided for the validation and ensuring that all of this is correct. Next slide, please. The sources that I've used today are listed on this slide. The ABB standards that mention validation are requirements 3.9 and 3.9.1. The retention of validation documentation can be found in table 6.2C, number 16, if you're looking for that. Other sources that I've used are the International Society for Blood Transfusion Guidelines for Validation of Automated Systems in Blood Establishments, which is published in Vaccine in February 2010, and it is available online. And then the FDA General Principles for Software Validation from January 2002. That's more for the vendors, but it does provide you good information on how to perform a validation. And then the FDA Guidance on Blood Establishment Computer System Validation in the user's facility is one that everyone who is performing a validation in a facility for your blood establishment computer system should be familiar with. That was published, the final guidance was published in April 2013.